All right. Good morning, everyone. Thank you all for getting up extra early this morning. We all woke up to the devastating and tragic news of the passing of Congressman Elijah Cummings, who, as we all know, was a trailblazer in the civil rights movement and for an entire career spoke truth to power. Some of the most impassioned and powerful speeches I've heard in my political career were all delivered by him. So I would like to give my colleagues an opportunity to say a few words in reflection, and then we will have a moment of silence to recognize his tremendous legacy. I'd like to turn it over to Councilmember Craig Rice to say a few words.
Well, thank you very much, Mr. Chair. And it's certainly a heavy heart that many of us who know and care deeply about those who Congressman Elijah Cummings championed for. Because we know it's a great loss when you have a pivotal leader like this who not only crusaded for those that are underserved and seek to represent them and represent the ideals that they possess, the power that anyone can achieve. The quote that he told me before I even decided to run for office that was so important about young people who are growing up in many of our inner cities: do not let your surroundings determine your future. Those words are powerful and stick with me because all throughout his life he wanted to make sure, growing up in South Carolina, in rural South Carolina where my mother grew up as well, understanding how hard it was for people back then to just try and get a fair shake, let alone get the same kinds of support that some of their counterparts had. And so his crusading for civil rights and justice, but for young people and youth, and making sure that they had a brighter and more positive future than their predecessors, is one that certainly will be missed. I hope and pray that we all lift up his family and friends in this time of need and sorrow, and certainly my heart goes out to his widow, Maya Rockymore Cummings, as well. So thank you, Mr. Chair.
Thank you. Mr. Glass.
Thank you, Mr. Chair. Congressman Cummings dedicated his life to justice, whether it was fighting for justice for the residents of Baltimore, the residents of Maryland, and from his perch atop the House Oversight Committee, fighting for justice and trying to preserve democracy here in the United States. I had the pleasure of working with him when I was a reporter covering Capitol Hill, and now as an elected official here in the state of Maryland, continued that collaboration, and he will be sorely missed.
Thank you both. Very well said. Let's have a moment of silence to recognize his legacy, but also reflect on what we can do to carry forward that legacy, especially in this great time of need in our country. Thank you all very, very much. All right, we're going to proceed with our very important deliberations and discussions. As I shared last week with your colleagues from other boards and commissions, I'd like to begin by thanking all of you for your public service, for your commitment to the residents of our county. I know that these boards and commissions don't come with significant pay raises, and I know you dedicate your professional time. And so I would like to very much thank all of you for your tremendous service. And our discussion last week was robust, and you realize as you hear from the respective boards and commissions how connected many of these issues are beyond just what you're focusing on with your specific board or commission. So we're going to do this in alphabetical order, and we will have each of you speak somewhere between 3 and 5 minutes. We're going to do 4 panelists at a time, and we will ask questions after each panelist provides their 3 or 5 minutes, and then there may be some questions after that. So I'd like to invite to the dais representatives from the African American Health Program, the Alcohol and Other Drug Abuse Advisory Council, the Asian American Health Initiative, and the Commission on Health. And I had the opportunity to speak to Mr. Art Williams, who in his own right has been a tremendous civil rights leader for a generation and more. And Ms. Vivian Yao will be reading his testimony on his behalf and on behalf of the African American Health Program. So would you like to say any words before Ms. Yao reads that testimony, Mr. Williams? Great. If somebody could help Mr. Williams pull the microphone closer to him and press the button right next to that microphone.
First, good morning. And I'm assuming this is only the...
To your left.
Okay. To the left and one to the left?
Yes, you got it. You got it.
I want to see your smiling face. Sorry.
Yeah.
Great. And thanks for inviting us and so forth. And as you can see, my two co-chairs, they're out of town, so that's why they're not here this morning. And but I'm here representing the African American Health Program, the Executive Committee. And even though, first thing I wanted to say, even though Gabe, Craig, your quote concerning Congressman Cummings was right on target, but he also said, don't leave your community behind as well. So from that standpoint. So with that said, and we have someone going to read, and I'll be sitting here if you have questions and so forth.
Great. Thank you very much, Art.
Thank you.
Ms. Yao.
Dr. Martin Luther King Jr. stated, of all the forms of inequality, injustice in health is the most shocking and inhuman. Health disparities and racial inequities adversely affect the Black community in Montgomery County in the following areas. AAHP is dedicated to reducing the infant mortality rate to below the Healthy People 2020 goal of 6.0. According to Healthy Montgomery 2013 to 2017, the infant mortality rate for Blacks in Montgomery County is currently at 8.3%. The AAHP Start More Infants Living Equally Healthy, or SMILE program, was developed to address infant mortality utilizing evidence-based strategies. AAHP has seen an increase in homeless pregnant women, which involves more complex interventions. Racial profiling is defined as any police-initiated action that relies on the race, ethnicity, or national origin rather than the behavior of an individual or information that leads the police to a particular individual who has been identified as being or having been engaged in criminal activity. Recent police-initiated actions directed at Black people underscore the inequities experienced by Blacks in Montgomery County. African Americans have a higher chance of developing post-traumatic stress disorder. Such racial traumas have a serious negative impact on mental health. Third, we applaud the steps that the County Council has taken to combat the vaping problem. AAHP is concerned that vaping poses a serious health risk in the Black community, which can impact the prevalence and incidence of lung cancer. Black smokers are more likely than whites to turn to vaping as a means of quitting smoking. However, former smokers who began using e-cigarettes were more than 16 times as likely to resume tobacco smoking. Fourth, according to the Alzheimer's Association, African Americans are twice as likely to have Alzheimer's, less likely to receive a diagnosis, and more likely to be diagnosed in later stages. While progress has been made in areas such as infant mortality, additional milestones must be achieved in identified zip codes with poor health outcomes. AAHP will continue incorporating primary and secondary prevention strategies that target our priority areas: infant mortality, cardiovascular health and diabetes, STI, HIV, AIDS, cancer, oral health. AHP will strive to reduce the incidence and prevalence of morbidity and mortality associated with these health disparities through the utilization of performance measures. A decrease in health disparities improves the overall health of Montgomery County, Maryland, and assists in the achievement of the priority outcome of thriving youth and families and a thriving economy. AAHP appreciates having this opportunity to share its priorities, as well as having input into the future policies of Montgomery County and the County Council. Having partnerships with the County Council and the Department of Health and Human Services that strive to eliminate health disparities and improve the number and quality of years of life for African Americans and people of African descent in Montgomery County are valuable.
Thank you very much, Ms. Yao. I've been very impressed with AAHP's work over the years and had the opportunity to attend your summit at the Civic Building earlier this year, which was extraordinarily well attended, but also very well organized with really dynamic speakers providing critically important information. I want to highlight the great work of Dr. Travis Gales in looking at the life expectancy of county residents across the county and just highlighting how devastating it is that there's a more than 21-year lifespan expectancy between those that live in Potomac and those that live in some of our northern parts of the county, which are predominantly African American communities. And so clearly there are systems that we must tackle and address, and as the previous councils have worked diligently to achieve. But I know our council is committed to continuing those efforts, and I don't know if my colleagues have any questions or thoughts or comments. I want to now turn it over to my colleague, Councilmember Craig Rice.
Well, thank you very much, Mr. Chair. And Mr. Williams, I just want to extend to you great thanks to the African American Health Program for its work over the years and continuing to really move the needle when it comes to eliminating health disparities. Your great work when it comes to reducing infant mortality, SMILE program, all of the programs that are out there that you've done, partnering with our religious institutions throughout the county to set up diabetes and heart health awareness, cardiovascular disease awareness. All of those things have made a tremendous difference. The challenge is we still have those inequities that continue to exist, and let's not pretend that they don't because of so many things beyond African American health programs control. When we're looking at zoning, when we're looking at the location of access to high quality food, when it comes to access to quality health care, all of those things play a role in terms of impacting as well. And I think that this council, and I really want to applaud our council president for leading this effort, but all of us up here who have committed to this racial equity framework that we're going to have that now is going to look at every single decision we make and really help us to shape those decisions to make them so that we're eliminating some of those barriers that then contribute to those health disparities is going to help in your mission. And so I just want to let you know that we hear you, we've heard you, we see what you're doing, and it really does matter and make a difference. And I'll just close by saying this. As the son of two parents who both have struggled with diabetes, I know that it's something that is now a risk for myself as well. Not only for myself, but then for my children and their children. And so it certainly is something where it becomes in a moral imperative for us as we understand and see directly what's happening before our eyes to make sure that we're informing the community about what the challenges we face are and how we can fix them. The reality is that this isn't the same as finding a cure for cancer or finding some other cure for some disease. This is about being vigilant about the things that we know can actually result in prevention and not have the onset of these types of conditions come about. We have the power to make it happen right here, and we have the power to do it here in Montgomery County. We just have to do the work. So thank you very much for highlighting these issues, and I look forward to working with you and the program to make sure they come to fruition.
One thing I want to underscore in Councilmember Rice's comments is the partnership with our faith community, particularly in reaching out to our minority populations because of the trust that's established there and the connections that I think provide a really important bridge. And so that is work that I think we can more directly connect with our Office of Community Partnerships. I know there's already a strong partnership and alliance there, but that is something moving forward we should explore and see how we can help further support. And I also, for the record, want to commend my colleague, Councilmember Craig Rice, who worked diligently behind the scenes to help ensure that our minority health initiatives receive some extra funding this year to carry out their important work. So, turn it over to Councilmember Glass.
Thank you, sir. Thank you, Mr. Williams, for your service. And in brief, I just want to say over the last 11 months in serving on the council, it has been a great awakening for me to see the depth and breadth of the services that we provide here, the number of community organizations who work deep in the heart of the communities in which they serve. And one example of that was back in June during the month of Pride, when I was having events throughout the county celebrating LGBTQ friends and allies. I became acquainted with an organization called Us Helping Us, which is basically a mobile med type organization which goes into African American communities and helps provide HIV services and testing. And that was an organization that was unbeknownst to me beforehand. And so as I continue this term on the council, I look forward to deepening my relationship with you and with all the other boards and commissions and committees that are here today. But just wanted to share the educational experience that I am undergoing and look forward to deepening it.
Great. Thank you very much again, Mr. Williams, for your leadership and that of your colleagues. All right, let's turn it over to Ms. Elise Grossman from the Alcohol and Other Drug Abuse Advisory Council.
Hi. Good morning. Chair Albornoz and Chair Glass, Councilmember Glass and Rice, thank you for this opportunity to speak to you today. Once again, my name is Elise Grossman. I'm the chair of the Montgomery County Alcohol and Other Drug Abuse Advisory Council, AODAC for short. So the consequences of alcohol and drug use and abuse are becoming increasingly lethal. In 2018, there were over 2,400 alcohol and drug-related intoxicated deaths in Maryland. This is the 9th year in a row that intoxication deaths in Maryland have increased and represents a 5% increase in the number of deaths since 2017. Of these deaths, 89 occurred in Montgomery County, more than double the number of deaths that occurred here in 2007. However, for the first time in 8 years, the number of deaths has finally started to decrease in Montgomery County and is down from last year. But that doesn't mean that our work is done. It's also important to note that not all alcohol and drug intoxication deaths are a result of the opioid crisis. In 2018, 21% of such deaths in the county were from alcohol. Childhood and early adolescence is a time when people are most likely to begin abusing drugs, including tobacco, alcohol, prescription, and illegal drugs. Particularly concerning to AODAC this year, as is evident also in the county, is the increase in vaping and e-cigarettes among youth. From 2011 to 2015, e-cigarette use by high school students increased by 900%. As of 2018, more than 3.6 million U.S. youth reported using e-cigarettes in the past day. This is essentially 1 in 5 high school students and 1 in 20 middle school students. Unfortunately, there's very little data about the usage rates in the county itself. Therefore, AODAC's first priority for this year is to examine how vaping and e-cigarettes are addressed in the county and provide recommendations for improving the situation. As such, we've already begun reviewing the bills that have come before the County Council, and we're really impressed already at the start. And we talked with Beth Schuman about arranging times to further discuss with you our suggestions and thoughts about these bills. Secondly, we know that each year the county spends millions of dollars on alcohol and drug prevention and treatment programs. Sadly, this is not enough. Research shows that for every dollar spent on prevention, we save $10 in long-term savings. And for every dollar spent on substance use disorder treatment, we save $7. Therefore, AODAC's second priority for this year is to continue to advocate for adequate funding for alcohol and drug prevention and treatment programs and for evidence-based laws regulating alcohol and drugs in the county and the state. And one part of advocacy is education. As such, AODAC with other partners will be hosting a marijuana forum on Saturday, December 14th from 10 a.m. to 12 p.m. at Gaithersburg High School. The goal will be to educate members of the community on how recreational marijuana is currently used, the public health consequences of its use, the laws surrounding its use both nationally and in Maryland, and the impact its use has on various populations. We hope that each of you can attend. Thank you.
Thank you. I really would like to attend that conference because I have a lot of concerns regarding the marijuana discussion, and so I really commend you guys for your leadership on so many areas, but I look forward to participating in that conversation and appreciate your comments regarding the vaping issue as well. It caught all of us well, many of us have been looking into this issue, but I think just the sheer magnitude of it caught all of us by surprise this year. And so I really want to thank my colleagues for showing a lot of leadership and trying to address this issue collectively as a body. I guess we recently had a briefing on drug court and some of the partnerships within our judicial branch, and really some of the remarkable work that's been done to help divert people to help seek treatment. But as I have learned through this process, there just aren't as many beds as to come even close to what we need. And so clearly there has to be some crossover in collaboration with our colleagues in the delegation and at the state level as well, because this is obviously a complex issue, but treatment is so important, and there are just not enough options for families right now. So appreciate your comments. I don't know if my colleagues have anything else they'd like to add. Start with Councilmember Glass.
Thank you, Ms. Grossman, for your comments and your ideas. And first, I just want to thank my colleagues for their leadership on the vaping legislation, particularly Councilmember Chair Albornoz, who is leading all three pieces of legislation, and Councilmember Rice, who is leading one of them as well, and I'm supporting all of them for the record. So my question for you, though, regarding the funding that you're talking about, what type of marketing and educational activities have you found are the best for the type of outreach and education that you're looking for?
So when we talk about alcohol and drug issues, unfortunately, education is important, but is not as successful as other sort of larger environmental policies. But it definitely, working in hand with other policies, it tends to work. When we talk about education, we do a spring forum every spring where we look at different alcohol and drug issues to reach out to the community about. We've done one working with the Mental Health Association, MHAC, we work with them. And so each year we have a different forum on all sorts of different topics. I think it's important to work with the school system and sort of the education, that piece. But I think it's also important not to just focus on education. I think sort of environmental policies that are broader. So for example, when you talk about alcohol, one of the things in our county that's come up routinely for debate is the issue of privatization. And the research continuously shows that a control county, like the other 17 control states in the country, works. That and this is a broader policy, it's not education, but that it reduces alcohol consumption, harms among youth, adults. So I think continuing to look at policies that have these broad-ranging impacts. But when we talk about funding, it's important to fund treatment. There aren't enough beds, but it's also important to fund prevention. We know that we have to start prevention in the schools, prevention among youth who are not in the schools. That's sort of an important key as well.
Yeah, I appreciate the holistic approach which you're describing, because all too often if we're talking about marketing or getting the word out, it's slapping a nice banner on a ride-on bus, right? And we think that's the message. But I hear you and look forward to working with you and seeing what we can do.
Thank you very much.
Councilmember Rice.
Let me just say that one of the biggest mistakes that we've made as the chair of the Education and Culture Committee is that we went away from, because we felt DARE wasn't the right program, that we decided to pretty much abandon when it came to doing a prevention model in our school system, something that was cohesive, that was across the board at every single school and consistent. And I think that, again, we've got one-offs here and there that do well. I think about Magruder High School with its Every 15 that does a great program regarding alcohol prevention. But the reality is that that's not at every school. And when it comes to vaping, it's one of the things where I think that, again, with vaping, with alcohol abuse, with drug abuse, all of them, we need to do a better job because people are still confused. And when you brought up about marijuana, that's one of the things where I, Mr. Chair, am equally concerned because people don't understand, right? People don't understand what the legalization of medical marijuana or the legalization of recreational marijuana and what that means and what those implications are, nor do they understand the ramifications that just as with vaping and addiction, addiction breeds addiction. And so from that perspective, just because you're addicted to marijuana and you're using that on a regular basis and may use it in small amounts doesn't mean that you won't graduate to something else. There are plenty of studies that say that, just as though we see with what's highlighted in the African American Health Program's testimony that folks who vape are increasingly likely to go back to smoking if they were smoking before because of that addictive quality of the nicotine that's in the vaping products. And so from that perspective, there's a lot that we need to do in terms of educating our kids and educating our community. So you're spot on. I'm going to be working this year, and hopefully we'll be able to set something up around the beginning of the year to talk with our school system about how we can better enhance the programs that are out there to inform our kids on a consistent basis about the risks that it poses to them. You're right, the numbers have finally gone down, but the fact is they're still too high, and there's still too many. We're losing too many kids, too many young people, too many people in our community as a whole to these things that, again, can be prevented. And so I look forward to working with you and your committee and with you, Mr. Chair, on making sure we increase some of those efforts. So thank you for highlighting that.
Thank you very much. I think this is really exciting to be able to work with all of you as we move forward. And I think the issue of alcohol and drugs is really interwoven with a lot of the policies, a lot of the councils that will come before you today. So I just ask, as you move forward in the year, to consider sort of this holistic approach and consider sort of the impacts you have on different policies as they impact alcohol and drug use and death and all of that. So thank you.
Thank you very much. Just one last comment. One of the other things that we need to focus on with regards to public education is eliminating the stigma that comes with this within families. I attended a vigil, and Judge Marisela Bernard lost her daughter and has been very public about the stigma issue and the education, and gave powerful, and I mean powerful, testimony on us needing to work together as a community to acknowledge that this is a disease and treat it as such. So I really appreciate your efforts. Thank you very much. All right. Has somebody from the Asian American Health Initiative arrived yet? Not yet? Okay. So then we're going to move on to the Commission on Health. Just want to hit the button right next to the microphone there, yeah.
Good morning, Councilman Rice, Councilman Albornoz, and Councilman Glass. My name is Christopher Byrd. I'm the Vice Chair of the Montgomery County Commission on Health. And it's my pleasure to respectfully submit to you its fiscal year 2020, Commission on Health's fiscal year 2020 initiatives. The Commission on Health is focused on three key public health priorities: school health, vaping and smoking, and communicable disease. We will coordinate and align these efforts with our fellow boards, committees, and commissions that also have similar priorities. Additionally, we will plan to align our priorities with the county exec's transition report. We see the opportunity to partner on the Thriving Youth and Families Initiative, whose goal is to get all children off to a good start in life. Because good health has long-term benefits to our community, our economy, in ways that we can only imagine. Just to highlight these initiatives briefly, is like looking at school health. Studies show that poor health can put a person's education at risk. Kids with poor health tend to have high absenteeism rates, which affect their grades, and then also too, it impacts the family unit. Finding ways to offset these illnesses and what have you. So what we really want to look at is due to the complexity of current health conditions that affect our youth, one way that we want to explore the opportunity of increasing the children's health in the county is to address the low school nurse to high student ratio. So based on this concern, we plan to conduct an assessment targeting school administrators, parents, and students and government agencies to support this priority, and we plan to identify current barriers and additional funding opportunities for the hiring of school nurses. A child's health should not impact their education. Looking at vaping and smoking, there's been 15 reported cases here in Montgomery County alone as it relates to respiratory illnesses and the relationship to vaping and smoking. We want to work with Councilman Aronaz and Councilman Rice on drafting legislation that addresses that and the sale that targets youth on smoking and vaping. Looking at communicable disease, the Montgomery County has experienced an increase in sexually transmitted infections such as gonorrhea and chlamydia that mirror state and national trends, and a rise in both active and latent tuberculosis cases. A closer examination of the epidemiological data shows a number of conditions with increasing trends and demonstrated disparities by race and ethnicity, age, sex, and geographic area. We'll review this data and provide appropriate public health planning to better target efforts and resources to meet the evolving needs of our changing community in the great Montgomery County in which we all live in. We look forward to working with you, our government leaders, community organizations, and the community at large as we work together to achieve a healthy Montgomery County. Thank you.
Great testimony. My colleague, Councilmember Rice, reminded me that he and I sent a letter to our colleagues in the executive branch and the county executive seeking additional support for school health nurse programs. I was just dismayed to see we're last in the region in terms of the ratios between our school health nurses, and that also doesn't fully take into account that our school health nurses are directly responsible for the needs of our differently abled children within schools that require a lot of time and attention and love and energy that further dilutes their ability to address the needs of the school as a whole. And we also know, as an example within the vaping issue, that students are disclosing or showing signs of other public health issues and disclosing those to their school health nurses, and that includes mental health issues. And so this is something that is vital, and we are at least 20 school health nurses down from where we need to be moving forward. And I was heartbroken to hear some of the stories of our school health nurses who are having to cover in some cases, 3 or 4 schools.
Yeah, we really need to help them more, and school nurses really are literally in the realm of public health, the first line of defense.
Yes,
they encounter many of the problems that, because of where they're at, their location, is not everybody has the luxury or the benefit of going to a private a clinician,
exactly,
or a practitioner or a doctor. So having a nurse as a first line of defense can offset many, many, many preventable illnesses.
Absolutely. I'm just stating for the record, this is going to be among my highest priorities in next year's operating budget to try and reduce the gap that currently exists, because we know it's an investment, which I think will be wise. The other thing I'd like to say with regards to vaping, so appreciate your comments and efforts, and I am proud of my colleagues. The bills we've introduced, I think, are going to have a significant impact in preventing youth from accessing these products in the first place. But the reality is that we're going to have to partner all together as a community to lobby folks at the federal level, because one of the things we can't control is e-commerce. And many of the youth we've heard are accessing these products online and checking an arbitrary box stating they're over the age limit when we know they're not, and having these products delivered in some cases to neighbors' homes who they know work often or travel a lot, and then in some cases then selling those products to younger students. So this is going to have to be a collective effort beyond what we're doing with our local bills to see what we can do at the state and federal level. I'll stop there and see if any of my colleagues have any other additional comments. Councilmember Rice.
So I just want to talk about the school nurse issue because, Chris, you talked about it and touched on it when it comes to first line of defense. And it's on so many levels. As mental health, right, we're looking to expand the level of mental health counselors that we have in our schools. And unfortunately, our school nurses are the ones who serve as that first line of triage for our kids. As many of our kids present some of them that are experiencing bullying as a result of coming out, all different kinds of things that are mental health issues, whether it's being pressured into joining gangs in their communities, all these things. Our nurses are the front line, as you said, in doing that, and they're exhausted. They're completely exhausted. We've heard from nurses who've come into our offices and said that they're completely overwhelmed with all of the issues. Imagine dealing with being the front line when it comes to health itself, but then also dealing with mental health and dealing with setting up plans for children with, developmental needs as well. Right. Encompassing all of those things together, where it should be 3 separate people dealing with each of those issues, and sometimes multiple people dealing with each of those individual issues.
And in many cases, sometimes they're practicing out of their scope.
Exactly.
But
that's
they,
exactly
they,
right.
They have to address the need as it presents itself.
That's it. That's it. One of the other things that you highlighted that I did want to just put a pin in as well, Dr. Gales had reported to us about the rise in sexually transmitted diseases. It was actually the Today Show a few days ago, maybe last week, who highlighted this on a national level, and we're talking about this as well. This is something we've been tracking and something that's very concerning. It's one of the reasons why my former chair of the committee, Councilmember Leventhal, in his effort to make sure that there was contraception in our schools and working with that, because we saw this at the very beginning as a rise, and it continues to be an issue. I mean, it's one of those things that's very interesting. When we saw the AIDS epidemic, we saw an increase in terms of vigilance when it came to contraceptives, and therefore we saw a significant decrease in STDs. Now that we've gotten a handle on the AIDS crisis and have a lot of great medicines that are out there to help folks feel as though it's the wild, wild west again and they can do whatever they want. And that's why we're now starting to see this rise again in terms of STDs. And so it's very concerning. So thank you for highlighting this again. It's something that Dr. Gales had briefed the HHS committee on, and something that I think we do need to do a follow-up on as well. So thank you.
Thank you. Look forward to working with you.
Great.
Have a good day.
Thank you very much. All right, I do believe we have a representative now from the Asian American Health Initiative. If you could come down, Sam. Could we also bring up the Interagency Commission on Homelessness, the Latino Health Initiative, and the Mental Health Advisory Committee? Doctor, thanks for joining us. The floor is yours. We're doing about 3 to 5 minutes of opening comments, and then we'll ask questions after your testimony.
It became red. Is it okay now? Good morning. Sorry to be late today. It's a pleasure to be here, and I'll just go ahead. Now, in the fiscal year 2020, AHI proposes to add a new dimension to its overall programs by adding a wellness program. Now, while they are going to maintain and expand the behavioral health and seniors program, the wellness program will be an additional dimension. This will help adopt a more in-depth and meaningful service for the well-being of the Asian residents of Montgomery County. The concept of wellness program overrides the narrower context of specific disparities and morbidities, which practically have been the cornerstones in the formulation of health programs. The right to health and wellness is just not the absence of or elimination of disease. To quote the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. One of the principal attributes of a wellness program is that it addresses symptoms of diseases that fall into the category of chronic diseases. Unhealthy lifestyles of people like poor eating, lack of exercise, nutrition, lack of knowledge on how to manage chronic symptoms, these lead to chronic diseases. The wellness program is an alternative approach to just prevention and focuses on healthy lifestyle and special discipline and personal discipline to help manage symptoms before they get out of control. This is going to be a very powerful tool to empower an individual to elevate their state of well-being. It is also expected to result in tremendous cost savings for the healthcare system as hospital ER costs are going to go down. The amount of prescription drugs are expected to drop. Longevity should increase. Mental health and social interaction should improve. AHI proposes to implement the program through both evidence-based programs as well as a holistic approach. Now, coming to the behavioral health part of it, the past few years of work on mental health of Asians has been a learning curve and has been a dynamic process in uncovering the unmet needs of the seniors. The Asian American older adults happen to be the largest minority population segment in our county. The known issues of older Asians, or for that matter any senior, is loneliness, social isolation, stress, burden of caregiving, economic challenges, physical, mental, and financial abuse. Effective outreach to Asians has always been a challenge, and therefore AHI has been working to develop soft tools to outreach effectively this segment of the population. For example, the photo novels developed in the past few years have been very, very effective, and the latest one developed and released in May of 2019 has an accentuated focus on the emotional toll taken on caregivers. Now, the other growing concern related to mental health is suicides. In the same forum, maybe more than 10 years ago, I have spoken about the data on the suicides, and they still remain the same. If not, they have grown. According to the CDC, 25% of suicides have increased between 2009 and 2016. The younger females, aged 15 to 24, have the highest rate of suicide across any ethnic group in the country, and senior females too. Teen suicide attempts are the largest among the Asian teens, and the number of deaths resulting from suicide attempts are also the largest among the Asian teens. So our approach, an enhanced use of culturally and linguistically competent education programs developed by AHI to educate Asian American seniors on health, wellness, and lifestyle choices. Number two, program activities are to be concentrated at local healthcare, senior centers and faith-based organizations. Partnership with community partners and stakeholders are to be enhanced. Greater collaborative efforts with Montgomery County Department of Health and Human Services, Aging and Disability Services. And finally, AHI has grown through its community services to a point that it was felt that a blueprint document became necessary. The document, in fact, is almost ready, which is to be designed to create a roadmap for the decade ahead and should serve as a guideline for improved health and wellness to the Asian American communities. On behalf of AHI, I appreciate the continuous support that we receive from the council members and the council. Thank you.
Thank you very much. I'm very familiar with your unbelievable leadership in so many different levels, and I actually recently had the opportunity to go to a health event hosted by the Chinese Culture and Community Services Center in Gaithersburg, and I was blown away. So they have recruited doctors from NIH and some of our federal partners to pro bono come and provide free healthcare services at a clinic that is extraordinarily well organized and well staffed. The other thing that impressed me with regards to their efforts is the focus on prevention and Tai Chi, acupuncture, some of those non-traditional ways that we approach overall public health, but that are just as important and helping decrease social isolation. So I think that was just a really great model that I think other communities can follow, and takes a great deal of volunteerism and coordination, but those are investments that are wise for the county to make, because the dollar that we invest is extended so extensively through those partnerships and alliances and volunteerism. I also want to highlight the mental health issues, which I know are very important and a taboo subject within our communities to discuss, and something that unfortunately families don't feel comfortable coming forward with. I know this has impacted my family and many others, but something we need to make sure communities feel comfortable coming forward to discuss these issues. So I really want to commend you for your work and appreciate your leadership. Did any of my colleagues have any additional comments or questions? Councilmember Rice.
Just very quickly, Sam, you know I'm a big fan of the great work that you've done, and with all of our minority health initiatives, it's why I continue to believe that we need to continue and invest in how you're able to not only reach the community, but innovate of different kinds of ways to best address the health disparities that continue to exist in the community. And so just want to say kudos again for coming up with the next iteration of what we need to do to continue to reach our communities. I will say that it's unfortunate. I live in an area that I see all too well, to where our Asian and South Asian populations tend to be isolated. And by isolated, they're in their own communities, but not necessarily ingrained in the rest of our community as a whole. And especially when it comes to our seniors, then that creates a challenge. I know that my neighbor to the right of us lost her husband, and both of them used to go to the senior program at Germantown Recreation Center. And so everyone now is kind of taking her under our wing as to make sure that we check on her, knock on the door, see how she's doing, all those kinds of things, because we know that we see it a lot to where there's that isolation. There's a language barrier that exists, and it's very interesting because a lot of people always talk about our Latino and Hispanic communities when it comes to English language learners, but don't talk about our Asian and South Asian population that also has the same language barriers, and we don't pay them as much attention when it comes to trying to get them to be able to be a part of our communities as well. Something I mentioned to Mikhail in terms of an effort that we can continue to address. So thank you very much again for addressing it. I look forward to continuing to support your initiatives. I think that they're incredibly important and are very successful in getting accomplished, which is reducing those disparities. So thank you.
Thank you again for that work. We look forward to the continued collaboration.
Thank you.
All right, we're going to move on to the Interagency Commission on Homelessness.
Good morning, Council, and I apologize for being late. I'm an Endo warrior, so today it was Endo 1, Ebony 0. So I am here, and I am committed to fighting for homelessness. So our number one priority is in December 2015, Montgomery County was one of the first 4 jurisdictions in the country to effectively end veteran homelessness, which was confirmed by the U.S. Department of Housing and Urban Development, the U.S. Interagency Council on Homelessness, and the Community Solutions Built for Zero campaign. We have housed more than 156 veterans since the Zero 2016 effort officially kicked off in June 2015, and only 5% of them have returned to homelessness. As part of Montgomery County's fiscal year 2016 budget on appropriation in the amount of $500,000 was approved to provide housing and supportive services to homeless veterans in the county. As part of Montgomery County's fiscal year 17 budget, an appropriation in the amount of $150,000 was approved to provide permanent supportive housing to homeless veterans in the county. The county has utilized federal funds like Veterans Affairs Supportive Housing Program, also known as VASH, and Supportive Service for Veterans Family Program the county's strong commitment in seeking and securing local funds to serve veterans who cannot readily be housed with remaining federal resources has been the key to the success of ending veteran homelessness. It is our recommendation that the county continue to fund these programs that assist veterans regardless of discharge, and that the county advocate with federal and state to provide ongoing funds to HUD-VASH. Our second initiative is Inside, Not Outside initiative, which is building upon the success of the Veterans Zero 2016 campaign. The county committed to effectively ending chronic homelessness. Chronic homelessness is defined as long-term, 12 months or more homelessness for people with disabilities. Since the beginning of 2016, more than 422 homeless individuals living in Montgomery County have moved into permanent housing, with only 5% of them returning to homelessness. We are not aware of any community in the country that has housed a higher percentage of its chronically homeless residents over this time period. For the past year and a half, the county has seen on average 12 individuals identified as chronic each month. For perspective, when the Inside Not Outside initiative kicked off, the average number of chronically homeless per month was 274. As a direct result of this initiative, the county saw the largest decrease in the 2019 annual homeless point-in-time count of 23% from 2018. There was a 93% decrease in chronic homelessness and a 44% decrease in the number of individuals sleeping in the streets. In order to achieve success in ending homelessness, the county needed to secure additional resources to fund both supportive services and rental subsidies. The Continuum of Care was awarded additional funding from HUD to increase the supply of permanent supportive housing. The Department of Health and Human Services was selected to participate in a Medicaid waiver pilot program that covers a portion of the supportive services costs, allows more funds to be devoted to housing. Finally, the county increased the percent of the Housing Initiative Fund allocated to Housing First permanent supportive housing. The recommendation is the county continue to fund all existing permanent supportive housing that serve chronically homeless households. As with the Veterans Initiative, additional funding is needed to maintain our status of functional zero. To date, there are 40 highly vulnerable adults experiencing homelessness in our continuum. If they do not secure housing in a timely manner, they will become chronic. To prevent this from happening, $1 million should be added for additional permanent supportive housing.
Thank you for those comments. I'm going to yield to my colleague and friend Evan Glass, who is our lead on this very, very, very important issue.
Thank you, Mr. Chair, and Ebony, good to see you this morning. It has been a pleasure getting to know you and working with you on the Interagency Commission on Homelessness as a member myself, and you as one of the co-chairs. And the decrease that you mentioned with regard to the point-in-time count, I know many of us, some of us here in the room, were out till 2 or 3 in the morning counting, and I remember that was the first time I had done such an event, if you can call it that, and walking around, I was struck by how few people we were finding, which on one hand is a very good thing. It makes for a long night, but it was a good thing that the counts were down. And there's a lot of other work that's going on at the Interagency. You were talking about where we are and where we've come from, and I have to stop and applaud all the work that previous members of the council, current members who had been here, previous county executive, for the dedication and the funding and the foresight that they put into this, which is how we've got here. And so I applaud all of their efforts to get us where we are. And I remember participating in a hearing a few months back where we were told that Montgomery County is one of the top 10 jurisdictions in the country for this work, which is a great testament, again, to the work that our predecessors had done to get us where we are. Moving forward, I know that we do have some challenges. You alluded to some of that. There are some challenges with some of our providers, which we are the three of us are working very hard to mitigate. There's been some breakthroughs, and earlier this week we did provide some emergency supplemental to some of our providers, namely at Progress Place, so that they can get prepared come November 1st when the season begins, and that the City of Rockville, working with DHHS, have found a new site in the City of Rockville, city limits, to help bring people in from out of the cold and provide them with a safe environment as winter comes. And so there are a lot of different moving parts, but we're still on a pretty good foundation. And I look forward to working with you to do more. And last thing I'll say is that I've already drafted legislation that I'll bring to the council at the appropriate time, so that the Interagency Commission on Homelessness can do the next step in the work. Because as you outlined, the work with the homelessness has been very successful. And the next step of that mission is to make sure that we have housing for families, which mostly comprises of single mothers and children. That's the demographic we're really talking about. And so because of some of the federal funding and some of the focused shift, it will require legislation to facilitate that. And I'm working with our colleagues in the ICH to make sure that the agency is able to do what it needs to do. And so that'll be the next step coming from me, and I'll report back at our next meeting with that information. But again, thank you.
Appreciate your leadership, Councilmember Glass, and I see Amanda in the audience. Thank you and your team for all your hard work on this important issue. The Goody Drive issue is a challenge, and I do want to publicly thank our colleagues in the City of Rockville for stepping forward to be a partner in addressing this issue in the short term until we figure out what to do in the long term with regards to that strategy. I did have a sort of a question and a comment. I have heard recently on this issue that our colleagues in the District of Columbia, of course we know this is a cross-jurisdictional challenge with regards to homelessness, and that our partners in the District of Columbia, in some ways, I've heard, are not being as supportive as they could be in addressing some of the issues within their city and encouraging some of those residents to take advantage of the many programs we have here in the county, which is a good thing. But there already is a capacity issue, clearly. And so I didn't know, is there a corresponding commission from the District of Columbia? Has there been cross-collaboration and discussion from I know there has been at the staff level, which is so important, but often efforts like this are most effective when it's the community through advocacy that you really have the most impact. They have to work hand in hand. So want to get your thoughts on that.
Yes. So I forgot to say my name, which is Ebony Johnson, and I currently serve on the DC Youth Commission for homelessness. So they just stood up a commission to actually address that issue. They were funded for that, and they're responsible for providing a plan of action on how they're going to address youth homelessness. And then they also have an interagency commission in DC on homelessness as well. So we do cross-collaborate, and I equally support and participate in the DC homeless efforts as well.
That is fantastic. That's really good news. So you can help provide that bridge and that partnership. Thank you, Ebony. And I do want to underscore Councilmember Glass's point with regards to the next phase of this discussion, and that's addressing family homelessness. We're right now, I'm wearing my purple pin this morning because we're acknowledging domestic violence and the victims of domestic violence, which unfortunately often disproportionately lead to homelessness among single women with children. So those two issues are very much connected. And as we learned, and Amanda and her staff have been terrific in working with us, and I really want to commend Beth Schuman from my office, who's been a tremendous advocate for some of the families that have reached out to us recently this year. But it acknowledged sort of the gaps in the system, particularly as it relates to women with children. And so that does need to be sort of the next phase in identifying different housing options and opportunities that address their unique set of needs moving forward. So, and I know that's a goal of the commission moving forward as stated, and I really appreciate that. So thank you for your work. Councilmember Rice.
Well, thank you very much. I wanted to highlight two things. First, let me pick up where you left off, Mr. Chair. Women and their children and homelessness has been an issue that we've been focused on for quite some time in the HHS committee. In my conversations with our former director, Uma Alawalia, and unfortunately with her leaving, actually, kind of stalled our progress. And so, Councilmember Glass, I look forward to working with you, especially in your role as the lead for homelessness, on making sure that we can make that come to fruition. I know that Linda McMillan has some great ideas in terms of ways to move us forward, and hopefully in partnership with HHS we can make those things happen. I did want to highlight one thing that was a part of your overarching testimony, because we do read what you guys write, just so you know. And one of those is about the prevalence of race as it relates to homelessness. Certainly understanding that although we represent such a small portion of our population, and I shouldn't say small, in the teens in terms of percentages, but represent over half, even over 60% of the prevalence of folks who are experiencing homelessness. And so it's something that certainly, as you said, Councilmember Albanos, it ties directly to all of the other things that we care about that are happening in our community. It touches on domestic violence. It touches on affordable housing. It touches on health. If a person all of a sudden has a terrible health condition and can no longer afford to pay for their rent and for all the things that they do, and end up homeless as a result, or they went to the hospital and now have this overarching bill that now goes to collections, and their home is seized and they're evicted from their apartment. These are things that happen and are the reality of when you talk to a person who's experiencing homelessness, how it just spirals all out of control. And so that's why these events are so important, where we can bring stakeholders together who are working on so many different avenues, but they're all connected and they all matter, whether it's drug abuse, whether it's dealing with, a veteran coming home and not getting the assistance that they need and are experiencing PTSD, and so therefore are homeless as a result. I mean, all of these things are all there, right? And so we're working on it from so many different levels, and we have to do it all. That's the reality. We have to do it all. And I just wanted to close by saying thank you as we lifted up Congressman Elijah Cummings. I have to say thank you to Senator Chris Van Hollen, who has been a champion for us when it comes to VASH vouchers, who has been a champion for really ensuring that we got the support necessary when it came to our Gaithersburg facility, and bringing that to service our veterans when it comes to health care. He has been tremendous at really helping us to get over the finish line, and we would not have been able to accomplish what we did if it weren't for him. So really want to thank him, as well as all of you who continue to lift up our people who are experiencing homelessness in our community, really to take us to the next level. So thank you for your great work.
Thank you both, and thank you again, Ms. Johnson. All right, let's hear from our Latino Health Initiative, and Ms. Monica Escalante. Mm-hmm.
Thank you. Glad to be here. I'm representing the Latino Health Steering Committee, and I bring two priorities that we think are very important to the health and well-being of Latinos in this county. The first one is increase the number of Latinos serving in decision-making level positions in the Department of Health and Human Services and other county entities. What's the percentage of Latinos in the county? Do you know? It's 20%.
It's 18% as of right now. Likely will increase after the next census to over 20%.
Right. So what's the percentage of Latinos representation that we have when we're talking about Health and Human Services and other county entities? Under 5%? Right, so that's what we're talking about. Proportional representation of Latinos at all levels of the county's workforce continues to be a significant problem that hinders the county in its ability to develop and deliver cultural competent programs and services that respond to the entire community needs. These disastrous outcomes further become magnified, as in the case of the current anti-immigrant climate, which you have experienced yourselves lately. When an environment of fear and mistrust of local government further discourages accessing services despite of the county's long-standing progressive values and extensive resources for diverse communities. This climate has provoked a chilling effect nationally and locally, effectively wailing off non-native communities from accessing services, supporting public safety efforts, and from engaging in civic activities. The lack of Latinos in decision-making positions is evident within the current administration cabinet, as well as within key county departments such as Health and Human Services. Having highly qualified Latinos who understand the community within the highest levels of the county government, we think is essential. Essential for the development and execution of sound policies and strategies aimed at achieving social justice, inclusion, and equity. So that's our first priority. Our second priority is establishing an independent review group to receive, investigate, and respond to county Latino residents' complaints. Some of you are aware of these things already. As advocates, service providers, and legislators, we must work together to ensure that our community receives quality services and those seeking or receiving services are treated with respect and dignity. Too often we have heard that this is simply not happening lately. Service quality access issues, including changes in eligibility criteria for chronic conditions, and the dental services, which I have to tell you myself, I had to pay a big bill for a school student, and I was remembering that when we were talking about school health, that this fully eligible student who was supposedly fully eligible for dental treatment didn't get it for 2 weeks, and the problems were escalating. So a friend of mine and I took her to my dentist, and we took care of it, because people do die from toothaches. So that's, and Councilmember Albornoz, you heard this story before. I don't know if you heard it, Councilmember Rice. Might be your first time, Councilmember Glass. But we're very worried about this, the dental services. But that's not the only one. We are also talking about the safety net, the Montgomery Cares. And for the Montgomery Cares issue, I want to make sure you understand, we're not advocating for the service providers. We're simply bringing the voices of the community that is suffering with these changes. So during recent community conversation on racial equity and social justice hosted by the Latino Health Initiative, participants reported unfair and derogatory treatment while trying to access key programs and services. In addition, LHI health promoters and community partners have shared with us many Latinos are reluctant to reporting abuses and mistreatment out of fear of retaliation, including the denial of services. They're being told that they are not eligible when they are fully eligible, and because of looming immigration treatment. Having a safe space in which community members can share negative experiences, interacting with public servants and or in accessing public benefits and services from the county or from a county contractor. They need a place to go with these complaints. They need a place they can trust. Such a place does not exist right now. And Councilmember Rice, you were talking about language competency. This place needs to have a language competency. We believe that establishing an independent review group or an ombudsman dedicated to listening and following up with community complaints is vital to the rebuilding trust and reestablishing credibility with all county residents. Thank you.
Phenomenal testimony. I did have the opportunity to attend LHI's retreat earlier this year, and we had a robust, almost 2-hour discussion regarding all of these issues and more. And let me start with this. We did receive confirmation, actually quantified information, that confirms that there has been a precipitous decline in the access of our primary care clinics, in particular by our immigrant community. And you can draw a direct line between that decline and the rhetoric and the policies and the hate that is being spread by the President of the United States. And so that is something we're going to have to work collaboratively to combat. There is no silver bullet. It's just going to have to take a partnership and alliance with not only LHI, but our faith-based community, our community partners, community-based organizations, and a full court press to try and ensure that people know that they can come to our clinics. But when they get there, they have to have strong customer service. They have to have people who are empathetic to their issues, to their concerns, to their unique needs. And I've heard story after story of people coming to these clinics to be turned away because they didn't have the proper form or they didn't appear at just the right time and treated poorly. And that is disproportionately true within our dental health services. This committee will be hosting a work session to discuss our dental health clinics and our programs and services there. I encourage anybody who's interested to come to that work session, and if you have questions that you would want to make sure we ask of that committee, please share those with myself and any of the other members of our office. I also think that with regards to personnel and staffing, clearly that's one of the more acute examples of where we have fallen short as a government. But it's true across the board. Our staff does not reflect the diversity of the communities that we're trying to serve, and that does need to be a priority. And I know it is. The county executive has discussed publicly. He's brought forward a new director of the Office of Human Resources that is a change agent. That's how he has described himself. We have requested that there be an initial survey done and that questions related to the diversity of hiring and what specifically the plan is to ensure that these staff members, both at a frontline level but also at a management and administrative level, reflect that diversity, because that is just square one. It's fundamental and it's good policy. So agree with all of that. Also discussed at the retreat the concept of a town hall to bring forward community stakeholders who, for whatever reason, haven't felt comfortable coming forward with some of those concerns, but that leadership be there to hear those concerns and to help try and address those. And we look forward to working with LHI on that town hall, and we'll be following up on setting up a date to work on that as well. But it's an issue I'm very passionate about, as I know my colleagues are as well, and can't thank LHI's leadership enough in this space.
And I think I said this before to you, that we all want to improve things in the future, but right now our community is hurting.
Yes.
Right now those tooth problems are not being addressed. Right now people with chronic illnesses are not getting a third appointment, and they have no place to go. So I can't stress enough how, yes, we all want a better future, but today is urgent.
Agree. It has to happen now. One of the concepts I also discussed, which I think I've mentioned to my colleagues in the dais, is the concept of a circulator bus, because one of the issues, particularly for our minority health initiatives, is just access. We all did the public transit challenge, and my colleague, Councilmember Glass, does public transit more than I think all of us combined. And that was enlightening to see firsthand, having to take 2 or 3 buses and doing that in some instances with children. I've got 4 kids under the age of 11. I mean, it's hard to get physically to these locations. And so the concept of a circulator bus on certain days, as we've done with our senior centers, which has increased participation rates, is one of many potential solutions that I think we need to explore, but one that I'd like to see us move forward with. And I've discussed this with Dr. Crowell, who's very supportive of the concept, and something we're going to explore as a committee moving forward.
Thank you.
Councilmember Rice.
Just very quickly, and Mr. Chair, you've pretty much said it all. I just wanted to highlight the dental piece is so incredibly important. It was some 6-7 years ago, I think, in Prince George's, where you had the young student who actually died from an abscessed tooth. So this is the kind of thing where, again, and we've tried to pay attention to the wait lists that are associated with our public clinics when it comes to the dental services. We know that we don't have enough. It's actually something that just recently I was talking with a provider who is no longer contracted with HHS. And so I'm really paying very close attention to what's happening with our dental services. It's one of those things where I think we got a handle on it. Right after that, it's always one of those pendulum swings. So right after that, everybody was paying very close attention to dental care and saying, hey, we've got to do this. And then as things subside and you don't hear about the wait list as much and things tend to be going well, and then all of a sudden it starts to develop again and you have this waiting list that exists. So we'll make sure that we follow up on that as we did before and identify where those gaps are and how we can eliminate those wait lists and ensure that, especially when it comes to, just as you said, I think people forget, but we all know it. When you have tooth pain, how are you going to sit through a class? When you have tooth pain, how are you going to be effective at your job? Because that always is going to be the thing that continuously is in your head. It's interesting. It's kind of disturbing, but in the military, part of what they do when it comes to some of the techniques that they use is dental work. So from that perspective, if that's the tactics that they use when it comes to getting to a person to have them talk, how do we think that a person who's just trying to deal with that themselves can do what they need to do? So, you know.
If you were to look 5 years back on the dental clinic visits, that will tell you the whole story.
Exactly. So thank you. Thank you for highlighting that.
Thank you very much, Monica. So this is a little unusual, but I shared with my colleagues I was going to do this in the near future. We sit up here for hours at a time, which is terrible for your health. And so we're going to try something new that I'm hoping my colleagues and other committees and eventually the full dais does. When we sit for longer than an hour at a time, I'm going to encourage us to take a brief pause, 20, 30 seconds, and stand up and stretch around a little bit, and then get back to the work of the business of this committee. So we're going to stand up and just stretch a little bit. And get back to the work of the business at hand. Thank you all very much. All right, let's move on to our Mental Health Advisory Committee.
Thank you, Chairman Albornoz and Council Members Glass and Rice for this opportunity to speak today. My name is Garrett Manchin, and I'm a Vice Chair of the Mental Health Advisory Committee. As I'm sure you know, our committee is tasked with evaluating the adequacy of the county's mental health services, identifying gaps in the system, whether they be in quality, availability, or continuity of care, and making recommendations to the council and county executive to fix these problems and fill the gaps. We have identified 3 priorities for the county's mental health system. The first, ensure residents' right to mental health parity, respond to the county's rising suicide rate, and improve the county's crisis response system. On the first point, we are concerned that the Montgomery County residents are not receiving mental health services and are using out-of-network benefits due to inadequate insurance coverage. Despite the fact that the Mental Health Parity and Addiction Act of 2008 passed 11 years ago, a recent study has shown that 1 in 7, of the providers listed on insurance companies' websites, 43% of them are reachable when you call, and only 1 in 7 are accepting new patients within 45 days. And additionally, we are aware that frequent prior authorization and continuing review requirements are often not based on objective medical necessity criteria. And finally, mental health providers are not being reimbursed at the same rates as mental health medical services in violation of the parity law. So what can the council do? First is work with the state to increase mental health services reimbursement and also provide supplemental reimbursement at the county level when needed, and educate the community on their rights under the Parity Act. Second, respond to the county's rising suicide rate. Suicide rates are increasing nationally, especially among the youth. Suicide is actually the second leading cause of death for people between the ages of 10 and 24. 17.2% of high school students surveyed said that they had seriously considered suicide, and 31.5% of high school students reported persistent feelings of sadness and hopelessness. We are investigating how Montgomery County is addressing this and wish to assist in increasing access to treatments that are proven to lower rates of suicides and suicide attempts. Specifically, due to increasing national suicide rates, we are encouraging Montgomery County to increase funding for Everymind's hotline. Everymind runs the crisis response hotline in the county, so that it can provide text services between 12 a.m. and 12 p.m. and provide follow-up calls for children who receive crisis services. Currently, the Everymind is only able to provide text and chat services between 12 p.m. and 12 a.m. 7 days a week, but it's increasingly becoming the primary means of communication among the youth. 65% of Everymind's text and chat conversations are with youth ages 24 and under, and 83% of those conversations require suicide assessments. Most conversations last about 60 minutes, requiring significant staff capacity, and they are missing nearly as many texts as they are able to answer due to their limited hours of operation. Additionally, the county should work with the providers to work on suicide issues and improve funding for Be the One campaign. Additionally, the county should improve access to mental health services in schools and in communities, and recommend a school-based mental health curriculum. After those types of curriculums are given, there is usually an uptick in students reporting to school counselors. The counselors, in turn, will request the mobile crisis team. So there needs to be support for counselors and school-based presentations so that students have someone to talk to after these types of presentations. And our third priority is to improve the county's crisis response system. The crisis response system, in addition to Everymind's hotline, currently consists of the mobile crisis team, which is 2 licensed therapists that are available 24/7 to respond to requests from 911 dispatchers and assist the police with acute mental health emergencies. The Crisis Center, which provides mental health services to individuals with urgent needs, and funding for the county's assertive community treatment teams, or ACT teams, which consists of a psychiatrist, a therapist, a nurse, and a peer counselor, and primarily treats folks with severe persistent mental illness who have previously been treatment resistant. We've identified a number of inefficiencies in the crisis services in the county. For one, there's a great deal of downtime with the mobile crisis team. It currently consists of 2 therapists. They're required to wait for the police unit to at least one police unit to arrive before they're even able to assess someone, which can lead to them waiting upwards of 30 or 60 minutes before they are able to, once they arrive at a call, to be able to actually talk with somebody. And oftentimes they have to cancel the call because the police never arrive. Second, we have only 1 mobile crisis team for the entire county. So that's for the largest geographic county in the state. It's difficult for them to respond to all calls. So we would recommend increasing the number of mobile crisis teams to 2 that are available 24/7. We recommend increasing the data, or improving the data that the mobile crisis team collects. One barrier has been that they don't collect, for example, the number of calls that they have to turn down, the amount of time that they have to wait before they can engage on a call, the number of people that they are able to link with mental health services, and the number of people that they're able to divert from the emergency department. Another recommendation is to ensure that the county is providing follow-up for people that receive mobile crisis services. Currently, there's no mechanism for mobile crisis team or anyone else to follow up with somebody that the team has been dispatched to. Such follow-up would increase the likelihood that clients connect with mental health services, decreasing the likelihood of subsequent 911 calls, emergency department dispatches, or the person getting diverted into the prison system. And finally, we recommend ensuring better coordination between the mobile crisis team, the police's CIT team, or the crisis intervention team, the crisis center, and the Everymind's hotline. Thank you.
Wow. Well, you guys could have a representative in each one of these boards and commissions, because this is very much a common denominator in a lot of the work of all of the boards and commissions. And as we've heard through social isolation, through homeless issues, I mean, the mental health issue cuts across generations, socioeconomic status, ethnicities, cultures. It's a big challenge. And we, of course, were reminded terribly this week with the passing of Officer T.J. Bamba, who took his own life, that the unique needs of our first responders are also a growing challenge. And my colleague, Councilmember Rice, and Councilmember Katz and I and others are moving forward with trying to work more closely with our law enforcement officials through policies and other means to ensure anonymity as people access some of these services, because it is a challenge on a number of different levels, and so these are areas that clearly we need to focus on across the board. So I really tremendously commend you for your work, and I think the recommendations of the Commission are sound. Yes, there are budget implications, but this is literally life or death for some of the people who are accessing these services, particularly our more vulnerable populations. So I'll stop there for now and see if my colleagues have any questions or comments. Councilmember Rice.
Just very quickly, so, we're blessed to have a great organization like EveryMind who continues to do great work in our community and lifting up and promoting mental health awareness and also providing the services. The reality is that they are overwhelmed, and just as you said, it truly is a much larger issue, and as we talk about it more, we get more people who come out. I would just want to do a public service announcement, and for Councilmember Jawando, who always jokes and says for the millions that are watching at home, but for those who can make this millions by talking to your friends and neighbors, I encourage you, especially with our children, look at your children's phones. Not to be nosy, not to try and, find out who they like in school or whatever the case may be, but I actually do random checks with both of my daughters and my 13-year-old daughter now, but when she was 12, I actually did a phone check and saw a chat between her and one of her middle school classmates who was contemplating suicide and was being bullied and was talking about how, and my daughter had actually taken it upon herself to go online and start chatting with a mental health professional to try and figure out what she could say to her friend to keep her from taking this route. And it's something in which I think that, again, we don't realize how prevalent this truly is in our community. We don't realize how much, and it's incidents like with Officer Bamba to where we remember and we all of a sudden, just as the chair so eloquently said, understand this affects everyone. There are people who are struggling with mental health all throughout our communities every single day who you will never know are struggling and who are making a go of it, some of whom have not even sought out services and who are just actually able to balance and make it work, and good for them for that. But then if something happens in their life to make that break, to have them veer off of that road, we don't know what the outcome's going to be. We don't know if the outcome is going to be that ultimate decision, if it's going to be seeking out services, if it's going to be, and so we've got to do a better job of making sure that the services are there when people are going to need it. And so I appreciate your recommendations. I think that they're spot on. I think that we really have to do more when it comes to expanding the access of these services. And it really is something, and I don't want to step, in a space where I'm not the expert, but I can tell you, and I know anecdotally, that especially when it comes to some of our communities of color, but also when it comes to our LGBTQIA plus community, that continues to be an issue, continues to be a problem when it comes to bullying, and then what the ultimate, and how that affects children and then affects their mental health as a result. And so this is a much larger issue than we're realizing, and so we're going to have to make sure we're beefing up what we need to ensure that we can respond in an adequate way. So thanks for that.
Councilmember Glass.
Just real quick, the comments of this, we could talk about this all day long. I mean, that's absolutely true. But without saying what has already been said, earlier this year I attended a youth media festival and was watching PSAs and short documentaries done by youth here in Montgomery County, and the openness in which they talked about these issues was surprising to me. Because of the stigma that's attached to it, at least for the adults, but the youth are open, and they recognize how traumatic life can be, how their friends are feeling and are affected by the realities of living, quite frankly. And so we need to be more thoughtful than we already are in piecing all of this together, and whether it is from the law enforcement personnel, those who are keeping us safe, and the emotional duress that they're going through, both on the job and in their own personal lives, which are inextractable, and then from our students as well. There's a lot more that we can do. So thank you for dedicating your time to this, and we definitely have to dive deeper.
Thank you very much. All right, let's move on to our final two commissions boards, the Montgomery Care Advisory Board and the Victim Services Advisory Board. And while they're coming up to the dais, I mentioned this last week when we spoke to our other boards and commissions. The Commission on Aging established what I think is a template that other boards and commissions may want to explore. They had a panel discussion at one of their commission meetings that invited members of both the executive and legislative branches, which I thought was a robust conversation with regards to budget, but also policy decisions within those departments. And so as you look at these issues cross-cutting among multiple agencies within county government, it's a unique opportunity to have your questions answered and, quite frankly, sometimes put people on the spot. So something you may want to consider moving forward. And I know I would be happy to participate, and I'm sure my colleagues would as well, as our schedules are able, in such a discussion. So let's start with the Montgomery Cares Advisory Board.
Good morning, Chairman Albornoz, Council Members Rice and Glass. I'm Wayne Swan, Chair of the Montgomery Cares Advisory Board. The Advisory Board provides guidance to the County Executive and County Council, which financially and operationally support the healthcare safety net for uninsured, low-income residents of Montgomery County. The Board considers fundamental questions about the structure and operation of the programs, including resource allocation, growth targets, and strategic planning. Fiscal year 2019 was a unique and challenging year for the healthcare for the uninsured programs, including Care for Kids, Maternity Partnership, Dental Services, Healthcare for the Homeless, and Montgomery Cares. The proposed changes to the public charge rule and similar factors have caused confusion and anxiety among residents. Despite this, some of the programs saw an increase in the number of encounters and patients served. The Montgomery Cares Advisory Board has identified specific priorities for each program. However, the following are three overarching goals that will guide the board in FY 2020. The first is responding to the political environment. The board wants to assure confidentiality and safety for county residents seeking access to care. In the transition of Montgomery Care's eligibility determination, the board has remained engaged with stakeholders and advising on the process. MCAB has requested data and performance measures to monitor outcomes and patient experience. We continue to evaluate and make recommendations as we explore the affordability issue for residents eligible for qualified health plans. The number of new enrollees in Care for Kids is growing exponentially, and we're focused on expanding adult immunizations for Montgomery Care's patients. The second is improving quality. The MCAB is emphasizing the need to have data and performance measures that show the effectiveness of the programs. This year, MCAB will focus on conducting quality assurance reviews for Care for Kids, Maternity Partnership, and Montgomery Cares. We will also evaluate the delivery of dental services provided by the county and private clinics to ensure cost-effective quality dental care. As the county faces ongoing fiscal constraints, it is critical to identify the most cost-effective platform for the delivery of dental care services. The final overarching goal is to increase communication and outreach. MCAB wants to promote and foster a sense of belonging for patients. The program currently lacks brand recognition in the community with limited accessibility to information online, lack of printed materials, and no funding for promotion and outreach. Things like periodic newsletters, participant handbooks, and email reminders for renewal give the enrollees in the programs a sense of connection and safety. These strategies will help with program and engagement and retention. We wish to commend the county executive, the county council, Department of Health and Human Services, and this committee for your continuing support. Thank you.
Thank you. That was concise and extraordinarily well stated. Do any of my colleagues have any questions or thoughts or comments? Councilmember Rice.
I would just say very briefly that it's my hope that the county executive, in his wisdom, will certainly provide additional funding as a part of this year's budget to Montgomery Cares. We need to expand. It's a no-brainer that as we grow as a county, we're going to need to expand the availability of affordable health care options for our folks who we know are underinsured and still uninsured. And so from that perspective, you serve as the safety net when it comes to ensuring that these things happen. We just heard testimony from our Latino Health Initiative about dental. I mean, these are all things that we know continue to affect our community and have so much of an effect on everything else. If people aren't healthy, they can't work, they can't go to school, they can't do all the things that we know they contribute to the overall fabric and quality of life here in Montgomery County, but also affect our pocketbook. The less people work, the less people are able to go to school, all those kinds of things, and parents have to stay home with them because they're sick, the less profitable we are as a county. So if you don't care about people just for caring about people, you should at least care about it from a financial perspective in terms of saying that this makes sense for us. So, you know, it's my hope that we'll see that continue to increase.
Thank you, Councilmember Rice. Councilmember Glass.
The need continues to grow, as you've shared, and I'll just briefly inject some of my own personal thoughts on this that as succinctly as I can say. I'm hopeful that after November of 2020, there will be some changes in Washington which will expand healthcare opportunities to all Americans, so that will help ease some of the burden that we're facing with this one particular program in this one particular jurisdiction.
Thank you.
Nicely said. All right. Thank you again very much for that testimony and your service. Let's move on to the Victim Services Advisory Board.
Good morning, Chairman Albornoz, Councilmember Rice, and Councilmember Glass. Thank you so much for this opportunity. My name is Robin Stimson. I'm the co-chair for the Montgomery County Victim Services Advisory Board, and wanted to go over some of our priorities that you have in front of you. The Victim Services Advisory Board, also known as VASAP, dedicates time to identifying the needs of crime victims to ensure that they are being met considering our county's budget. The VASAP recognizes the importance of community and providing quality services to crime victims in need. Thank you again for allowing us to serve. The VASAP has dedicated much volunteer time to survey victim-centered needs in the county and have identified funding priorities that we would like to please share with you. We believe that the following two policy priorities need immediate attention. Number one, which we've heard a little bit about today, was resolving the housing issue for domestic violence victims and their families. Domestic violence victims and their families are provided temporary shelter at the Betty Ann Kroenke Center, which is the only shelter in the county for domestic violence victims fleeing dangerous abusers. A subset of those transitioning out of BAK would benefit from transitional and permanent housing that is safe and provides opportunities for self-sufficiency. The board advocated for and helped in establishing properties on Fleet Street and Rockville to partially meet this need and serve as a model for future transitional housing services. However, these properties have been plagued with issues, as you may know. The properties became unusable for victims due to the discovery of high levels of lead. The board briefed several council members on this issue, and Council Member Sidney Katz's office has informed us that they understand that at this time the cost to replace the windows in a historically accurate manner is cost prohibitive, and that the Department of General Services, DGS, is pursuing alternate use of the properties. These properties are under the jurisdiction of the executive branch. As the board has spent years advocating for the Fleet Street properties to be used for domestic violence victim transitional housing, and the current status of these properties is dire, we are challenged with finding a path forward for this important board priority. The board is advocating for these properties to be restored and used for the intended purpose of housing domestic violence victims. If these properties cannot be restored, we are asking that alternative housing solutions be explored. We understand a potential solution would be to sell these properties to fund alternative properties to be used for domestic violence victims' transitional housing. In addition, the board will be advocating for some policy changes as well. Domestic violence victims face the dilemma that the average wait for housing vouchers is 2 to 5 years. Moreover, when using the Vulnerability Indexed, VISBDAT or VISBAT, a widely recognized tool used to determine the need for housing assistance in Montgomery County, these victims receive only 1 point priority. We are asking that this point system be revisited to award more points for domestic violence victims.
Good morning. My name is April Marone, and I'm a co-chair of the board, and I'd like to share with you our second priority for today. Our second priority is to increase funding for domestic violence offender groups. Trauma Services Abused Persons Program, or APP, offers domestic violence offender groups through a contractor. These groups are ordered by the judicial system to offenders in the county, are mandatory, and decrease recidivism. The funding allocated for the contract of these offender groups is minimal, and consequently, competition for the contract has been limited to one provider. Thus, services have been limited. The board advocates that this program be expanded to include funding for intensive individual therapy for high-risk offenders, psychiatric medical assessments for medication as appropriate, and additional funding for the contractor to do intake and offer translation services. The board additionally advocates moving towards the totality of the work being done by the contractor. At the very least, we advocate that the contract funding be increased to allow for competition among providers. As recommended by Councilmember Katz, the board would like to work with Department of Health and Human Services to develop a proposal for the county executive to consider as he crafts the fiscal year 21 budget. We have spoken to Dr. Crowell to discuss this priority, and we will be scheduling further meetings to discuss moving forward. Thank you.
Thank you for that testimony. Vivian, I would like to know from the executive branch what the update is with regards to the Fleet Street property and where we are with that, and then what the cost estimate would be for the renovation, because assets like that are few and far between, so we need to maximize the ones we've got. And I know obviously money can't solve all the issues, but if we've got an opportunity before us, we don't want to miss it. Quick question. So obviously we want to expand the capacity of the contractor to provide services. Do you have any feedback on the performance of that contractor with the limited services they're able to perform now? Or is, again, it's a funding issue, but expanding an existing contract, would that be wise? Or do you have any feedback or thoughts on the work of that contractor?
So from what I know is the contractor is able to do what they have been contracted to do. However, as that they're not able to do a lot of the services that are needed, the staff for VASAP has been doing that work, I guess, for them, but it's not under their defined work. So they're doing additional work that they're essentially not being paid or is in their job description to do, specifically intake and translation services.
Great. Okay, thank you. Defer to my colleagues. Councilmember Rice.
Thank you very much. So before joining the Maryland General Assembly even, so this is some time ago, I actually served on the Victims Services Advisory Board at the time. Then we put them together with VASAP. And so I applaud the great work that you've been doing over the myriad of years. It's incredibly important. The reason why is because I lost my aunt and her son and the nurse that was caring for him to domestic violence. Her ex-husband had actually contracted a person to kill them. And interestingly enough, my cousin, her daughter, also unfortunately experienced domestic violence and is now a single mother raising her child and availed herself of services with the Family Justice Center that we just celebrated with their 10th anniversary this past Sunday. As a council member representing the Germantown and Up County area, I've seen far too many cases of domestic violence that have ended in the ultimate result, which is the death of the girlfriend or spouse, wife, and one is far too many, which is the reason why this investment is so important. Safe haven and shelter is incredibly important. And so it needs to be a priority for us because we are talking about life and death here. We've seen it far too many times. So the amount of money that's required, the amount of time and investment that's required is minimal compared to what we're facing in terms of what can happen in these instances. And so I hope that we certainly follow up with our Department of General Services. We have lots of available space in this county that the county owns. It's just commitment. It's commitment to make it happen. If we can do it when it comes to Shady Grove and creating this great, vibrant community that's there and do land swaps there to make that happen, there's no reason why we can't do it for this population. And it ties into Councilmember Glass's priority before when it comes to women and children who oftentimes are often fleeing their perpetrators who are threatening not only their lives but their children's lives as well. We need to do better. And certainly I hope that we as an HHS committee in conjunction with the county executive can make this happen very quickly. So thank you for your advocacy.
Thank you very much. Did you have something to say? Okay. Thank you very much for your testimony and for your work and public service. So we look forward to following up and getting responses to those questions. So that concludes our discussion this morning with our incredible boards and commissions. Our offices are always open to you 365 days a year, so please do not hesitate to reach out with a concern or question or thought, and we look forward to your ongoing advocacy. Thanks a lot.